Today we're going to talk about some common shoulder injuries that we see associated with all types of sports. A couple of the common injuries that we see would be a shoulder impingement, rotator cuff strains or possible tears, and any type of tendonitis. So first we'll talk about shoulder impingement. Shoulder impingement is a pinching in the shoulder area, most likely in the top or more on the front side of the shoulder, that's caused by either an anatomical structure, which is just the forming of the shoulder, or the actual weakening of the muscles in the shoulder. Next we're going to talk about the rotator cuff. Your rotator cuff consists of 4 muscles that encapsulates the shoulder joint. When there's a tear in the rotator cuff, it's a tear in the tendon that attaches to the bone. In that time, it's either slightly pulled apart, partially torn in different segments of the muscle or tendon, or completely torn and it's completely separated. Next we'll talk about tendonitis. Tendonitis can occur where any tendon attaches to the muscle, and it's just a common case of inflammation down at the tendon. Some common symptoms that you'll see with these types of shoulder injuries are going to be increased pain and inflammation. It can be at just resting or with any type of movement. You'll typically see a lot of increased pain with any type of overhead movements, especially with overhead athletes, such as your volleyball players, your swimmers, basketball with your rebounding, or even simply shooting. Another thing you'll feel is just general weakness. You'll notice that one side you can get pretty high and stabilize something, or just be able to secure something. On the other side, you'll be able to get it there, but you won't be able to hold it there for that long. To test for any type of shoulder pain or shoulder injuries at home, we'll start with some basic tests that you'll try. Just standing at home, you don't even necessarily need a mirror, just any awareness of your body. So you're going to start standing nice and tall, and I'm going to turn to the side. So when you're working, you want to pull the shoulders back and down to keep them in place of where your shoulder blade should be. What you're going to start with doing, very simple, is just lifting your arms up to 90 degrees. If you don't have any pain here, that's awesome. Next, you're going to shoot to lift it a little bit higher. Most people with any type of shoulder pain will start to get some pain once they've reached past 90 degrees. The next test we're going to look for is going to be an empty can test, and that's going to be almost the same as what we just did. However, your arms are going to come out a little bit wider, so you're going to be looking at a 45-degree angle. From here, you're going to turn your thumbs down, and most people with shoulder pain aren't going to be able to get into this position. If you have someone at home, you're going to have them push down on your arms while you try to keep them at the same height. If you do have pain with this, it's going to elicit sharp pain through the front, and that's most likely going to be a shoulder impingement or any type of rotator cuff injury. Another test that we'll use for your shoulder self-assessment is going to be called Hide the Roses. Very common, it's exactly what it's telling you to do. You're going to take your right hand, I'll start with my right, you're going to place it back behind your back. Most people will not be able to get into this position without there being an initial amount of pain. So starting with your right hand, just trying to wiggle on the other side to see where you are in relation, and then you're going to take the left hand now and then take it up. So with shoulder injuries, you can't just generally look at the one spot that hurts. In order to strengthen your shoulder to get it to the position where it needs to be, we have to start with any postural deficiencies that you have. And this generation of people, or generally with anyone, we're often rounded at the shoulders, which is not a good start for anyone to start with strengthening. So in the beginning phases of any type of shoulder rehab here at LSTC, we're going to look at posture and general weaknesses in the shoulder area. Once we've found the weaknesses in the shoulder and how to properly put the posture back together, we'll then look at encapsulating the shoulder as a whole, strengthening the muscles attached to the shoulder blade as well as the muscles surrounding the shoulder blade. Once we're able to get you in the proper position for strengthening, we'll then be able to retrain the shoulder on how to properly move with general movements straight forward, out to the side, and eventually getting you into anything that's overhead. If you're an athlete having any type of shoulder pain during play, or whether you just feel a little weaker on one side, go ahead and give us a call or click the link below and we can get you in and get you back to practice as soon as possible.